Good morning, my name is Andrew Leach. I am a parent, GP and the sole founder of PED Portal, which is a health hub for children, improving collaboration between care providers of our children. I've come to realise in general practice that there are many challenges faced when it comes to looking after our patients, and one of those challenges is communication. It's a vital element of the care that we provide, and no more so than looking after children. And corporations are telling us, and such as the AMA, that we should all be working together, and that's where I want to draw on the education sector as well as the health sector to try and bring these together and the communication together. Research is telling us that early intervention is crucial. The earlier we can get on to problems, the better in the long run, and the less work we have to put in later. So I'm a GP, I'm busy, I'm seeing a lot of paediatric patients, and I've developed this idea out of the recognition that it's very hard to communicate with the people that look after children. So it's very hard to actually contact teachers and physiotherapists, psychologists, paediatricians. So I want to close that loop and bring everyone together in this portal, putting the child at the centre of this care and then creating a holistic approach to how we look after children. Healthcare at the moment is very segregated in this area, and we have a lot of problems with communication, as I said. I have to currently phone call teachers, and that can take days, and it can have lots of delays. Teachers also have been telling me that they are struggling to contact the GP and the doctors. And everyone's time poor, everyone's busy. We don't have time to be doing this over and over. I receive SMS messages, I receive Facebook messages from parents about concerns of their children, faxes, letters. This is a non-secure system. I plan to reverse that. I want to make this easier, accessible, up to date all the time, so that parents know what's going on and teachers also know what's going on, as well as the peripheral team. We also hope to improve the security of what is currently not a very secure system. So there will be an app for parents that they can log into to post their updates. They will be able to choose what the post relates to in terms of whether it's health, mental health, physical health, and who they'd like to see that post. That will then be uploaded to the portal. A web-based platform will exist and does exist for teachers and allied health professionals. GPs will have their information uploaded as they type it into their practice software, and a selection of what they would like to be included in this. Security is a big concern for parents, and so I will be making this secure through two-factor authentication, SMS or email as an option on logging in, depending on who logs in, and data being held on the Australian servers. So my prototype video, oh, do you know there's going to be music? Looks like this. A consent process and registration process will be comprehensive, enabling parents to tick off that they are aware of this being a confidential app, and that this does not replace medical care. The epicentre, the real focus of this is the scrolling newsfeed, which includes the updates from the whole team, as well as a list of the team members involved in the care of that child and contact details of those team members. There are alternate models that exist, including models through the school, and that includes the ability for parents to communicate with their teachers, but that's where it ends. We need to be able to close that loop and really help teachers communicate to doctors and parents in an inclusive way. We hope to expand into the RSCGP community, incorporate information and expand into the practice softwares, and hopefully spread our word through GPs, seeking funding and investment from private health organisations or from the practice software organisations to help us get started and really boost the awareness of this. We also need our IT input. So imagine being able to quickly communicate that this girl has headaches at school, or this doctor being able to feed back to the team that this girl has anxiety. Everyone then will be in the loop, and that's what PED Portal is about. Please contact me if you wish for more information. Thank you.